Hello, I'm Dr. Grant Garlick from Florida Orthopaedic Institute. I wanted to speak with you today regarding when do I know I'm ready for a knee replacement. Oftentimes people will approach me and ask in my clinic, when do I know? I'm not sure if I'm ready. How do I really know if I'm ready? And it's actually a difficult thing to answer. And I've been doing this for 15 years, and I think it's a challenge oftentimes just indicating certain patients for surgery. I think what it comes down to is what I've learned all these years is I think it comes down to function. When people, pain is something that we don't quite understand. The word nociception is basically an injury to soft tissue that causes pain. Pain is a behavioral response to this tissue injury. The tissue injury could be something like arthritis. So everyone has different pain levels. So pain is a difficult thing to use to try to classify if someone's ready, because some people may feel tremendous pain, others feel almost no pain. It's really what it comes down to is function. What people say is that it starts to interfere with their activities of daily living. So when one can no longer go out and enjoy a walk on the beach, a walk around the block, it's difficult sometimes to get in and out of a car. First thing in the morning, trying to get out of bed, it's just searing pain in the knee that takes maybe sometimes 45 minutes to an hour to go away. And they're not enjoying their life because they just can't be as active. And when that happens, oftentimes there's a psychological effect. And often a lot of my patients that deal with chronic pain, chronic arthritis, have mild forms of depression and anxiety. And what that is, it's related to their lack of function. Pain is one component. Some people have so much pain that they can no longer tolerate any type of activity. What else is important is when they've tried all conservative treatments for knee arthritis, when you fail all other treatments, then perhaps surgery is indicated. And of course, you have to be a medical candidate. For some patients that are just too sick to undergo the procedure, it's really not a possibility. What we've also found is that chronic arthritis can lead to systemic inflammation in our bodies that can adversely affect our blood pressure and our heart. So there are surgery could provide medical benefits as well. When it comes to surgery, I get asked all the time, what different types of surgery are there? And in general, there's different ways to get a knee replacement. There are patient-specific called PSI, where we will use a CAT scan or an MRI to build components off of the imaging to insert into a patient. Secondarily, there's something called navigation, where we take we actually perform navigation during surgery to help assist with our bone cuts. And finally, there's this traditional approach where we use measurements during surgery off of something called traditional jigs. Here's an example of a partial knee replacement. So this is just one half of the joint that's replaced. And why that's important is some people only have arthritis on this side. And when you only have arthritis on this side, we don't need to do a total knee replacement. There's no reason to take good cartilage out of the knee when we only need to replace one component. And why this is important for younger and active patients is that it's less pain, faster recovery, it can be done on an outpatient basis, less blood loss, and a higher function. Now this is an example of a total knee replacement. So what you can see here is that both sides have been replaced with metal, and the kneecap here has been replaced with plastic. and it's not the entire kneecap that's replaced. It's a bony cut here, and then we glue the plastic on there. But you can see that the whole joint has been replaced, or what we call resurfaced. So not everyone is has an indication for a partial joint replacement. And in that circumstance, we will go to a total knee replacement. Hope that was helpful.